One of the many sectors hit by this pandemic is meat processing. As employees in plants test positive, some are closing, and that's affecting supply lines, especially for pork and beef. David Akin explains the impact at the grocery store.
The Smithfield pork processing plant in South Dakota accounts for nearly 5% of America's pork processing capacity. It went offline indefinitely this week. Canada's biggest pork producer, Olymel, has also lost significant processing capacity. And in Calgary, Cargill has slashed production at a meatpacking plant that accounts for 40% of Canada's beef production. All of it because of workers sick with COVID-19.
So a relatively small number of these factories process a huge proportion of the meat in Canada and the US. And so if one of those goes down, it has a huge ripple effect across the entire industry and actually really threatens that entire supply chain.
And that ripple effect will reach consumers.
We might have some challenges in terms of variety and maybe on prices at a certain point.
We're not facing a massive food security crisis as a result, but I don't think that it will be as easy or as cheap to buy beef and pork in the next month or two as it has traditionally been.
Back at the farm, some producers are now stuck with hundreds of thousands of growing animals that still need to be fed. Southern Ontario hog farmer Stuart Skinner is okay for now, but he's worried about the future.
We're going to see, I feel, ongoing challenges due to COVID until there's an effective vaccine strategy.
Some hogs are going to food banks, others are being butchered and sold at the farm gate. Worst case scenario, some may have to be euthanized.
And the trick is to do everything we can to build in flexibility and create a more robust supply chain up and down from the farm gate right down to the grocery store.
Ottawa is trying to keep the production line moving, freeing up $20 million to hire more meat inspectors and negotiating to drop restrictions on interprovincial meat exports. David Akin, Global News, Ottawa.
We all know the rules now. Try to keep at least 2 meters or 6 feet away from other people. If the virus can't reach you, it can't infect you. But what's behind that 2-meter rule? Researchers at Western University in London, Ontario, looked into that question in a study about the seasonal flu. And the results are raising concerns about the transmission of COVID-19. Jeff Semple explains.
It's become a golden rule of the COVID-19 pandemic.
Please stay at least 2 meters apart from others.
Staying 2 meters or 6 feet apart to slow the spread. But a new study suggests your cough can travel even further than we thought.
We feel 6 feet is not sufficient, and you want to be more precautionary.
Researchers at this Ontario university built a cough chamber and asked patients with the seasonal flu to cough into the cube. The study found that even if you're standing 6 feet or about 2 meters away from someone who then coughs in your direction, around 10% of the cough droplets will reach you in about 3 seconds. And some of those droplets will then travel even further. One study at MIT found that particles from a cough can travel up to 16 feet. However, the bigger the distance, the smaller the viral dose, meaning the droplets are less likely to make you sick.
Of course, each droplet also has a weight. So what happens is that the heavy ones fall to the ground really quickly.
But coughing and sneezing are not the only causes for concern.
I think the jury's still out on whether COVID-19 can spread through aerosols.
There's no indication that COVID-19 can travel long distances, like measles. But there is growing evidence the virus can spread through speaking, even breathing, and linger in the air. One example, 45 members of this church choir in the U.S. became infected, even though none had any symptoms and all were avoiding physical contact.
If you're talking to a friend who's had garlic or curry or a drink over lunch, for example, if you can smell that curry, garlic or alcohol on their breath, you're close enough to inhale any virus they might be exhaling.
And the longer the exposure, the greater the risk. An infected person talking for 5 minutes in a poorly ventilated space can produce as many viral droplets as one cough. Experts say it underscores the importance of other safety measures, like ensuring proper ventilation and wearing masks, while also keeping your distance. Jeff Semple, Global News, Toronto.
the new series that goes inside the COVID-19 pandemic, from the front lines to the everyday heroes helping us cope with the unprecedented change. Coronavirus, the New Reality. A Global News special, Sundays at 7 on Global.